If you haven't taken your seat, please find one. Please do so. Richard. May we request all personalities needed at the presidential table to please occupy your respective seats. Okay, everyone, settle down. We're beginning at this very moment. Okay. At this juncture, may I please call on, since this is a joint meeting between RC Makati and RC Makati Business District, may we call on MIPs Michael Escaler and Tess Castro to jointly call this meeting to order.
On behalf of the Makati Rotary Club, I call this meeting to order.
On behalf of Rotary Club of Makati Business District, I now call this joint meeting to order.
On behalf of the Rotary Club of Palawan, who is joining us by Zoom, I call this meeting to order.
Thank you very much, Presidents Michael and Tess. My name is Past President David Ackerman, and I shall be doing moderating functions on behalf of Director Andrew Prieto, who will be with us shortly. So for now, you have to bear with me. This is once again a joint meeting with the RC Makati Business District, and we welcome our Palawan clubs on Zoom. And of course, this is a Ladies' Day. That's why we are honored. We are also honored to have our aunts here in attendance. So may I please ask everyone to rise for the invocation to be led by CP Mache Ackerman. And please remain standing for the national anthem and the Rotary hymns of each club. Thank you.
Good afternoon, everyone. Let us bow our heads. Almighty God, our Father, we praise and thank you for this day. You have given us another opportunity to appreciate life and to fulfill our mission as your instruments of peace and progress. Please help us to amend our ways, and may we learn to pattern our lives through your Son's example, to realize that your guiding light is our inner strength. Father, bless all our endeavors, especially today's meeting. Guide us in our discussions, and lighten our minds in every decision that we make. Give us your grace that we may effectively do our parts as Rotarians, your instruments to serve humanity. Bless our plans, programs, and projects so that we may achieve our objectives for your greater glory. All these we ask in Jesus' name, amen.
Teres na silangan ng alam ng sa dagat at bundok sa sigat. Sa langit mong dukha, may dilagan nila at awit sa bayang dinamang. Ang kislap ng watawan mo'y karoon na nagtiwinig. Ang bituin at araw niya kaya kapag mag-ibig. RC Makati Rotarians, please, I invite you all to participate.
We're the Rotary Club of Makati, and together we stand proud. We are leaders with integrity, always ready to serve humanity, always living by the four-way test, building goodwill and peace along the way. To aid our fellow men, as true Rotarians we live to lead. We believe in service above self, and this is why we succeed. We're the Rotary Club of Makati, and together we stand proud. We are leaders with integrity, always ready to serve humanity, always living by the four-way test, building goodwill and peace along the way, giving hope to the world. We're the Rotary Club of Makati, giving hope to the world. The Rotary Club of Makati.
Okay, we ask everyone to take their seats first and invite all members of RC Makati Business District to remain standing. And please sing your song, your lovely hymn. Yeah, of course, everyone's invited. Song.
Ready to serve, ready to share. Through the Rotary Club is how we show we care. Ready to serve, ready to share. Through the Rotary Club is how we show we care.
Round of applause to our daughter club, RC Makati Business District, led by MIP Tess Castro and their charter president, Mache Ackerman. Okay, can we invite everyone to please settle down? Settle down, please, settle down. Settle down, please, everyone. Okay. Rotarians, please follow after me, as this is a very crucial part of what defines us being Rotarians. The four-way test. Children, thank you so much. Number one, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? Thank you so much, Rotarians. Now we move on to the greetings to birthday and wedding anniversary celebrants. Today is February 7 and we happily greet PP Cesar Campos. A blessed birthday. Is he here? PP Cesar, happy birthday. Stephen Javier and Andre De Jesus, February 9. Brian Liu, February 10. PP Rene Limhoco, February 11. Rotary Ans, happy birthday. Crisel Medalla, February 10. Marilu Alejandro, February 11. Melanie Lopez, February 12. And happy wedding anniversary to Jojo and Joy Concepcion, February 11. Oh, directors Bom and Ami Villatuya, February 11 as well. Congratulations. Ron, what's next? Do we acknowledge our guests first? Okay, now we move on to the acknowledgement of dignitaries and guests. We do see past District Governor Tony Kila here. Gov Tony, please stand up and be recognized. Past District Governor Sid is not yet here. PDG Peps Bengzon is not yet here. The DGND Reggie, is he around? Okay. So, our aunts, led by First Aunt Papat Escaler. Where's Papat? First Aunt Papat is here. We also welcome online Tita Nelly Bengzon, Marisa Del Rosario. Of course, Lady Yvonne Kwan is here. Please stand up and be recognized. I also saw Meli Parungao. Mita Soliven, Angela Garcia, Camille Macasyar, Tess Asioche, of course. Of course, lest I forget, someone very important to me, who happens to be my ex-girlfriend, also an aunt of RC Makati, Charter President Mache Ackerman. Round of applause. So how we will do it is, if we can please invite a Rotarian from each table to acknowledge guests and visiting Rotarians in your respective seat. Can we start with Neil?
Hi, good afternoon, everyone. In our table, we have Rotarian Gio Torres from the Rotary Club of Parañaque Southwest.
Welcome.
Can we give him a round of applause?
Round
And
of applause.
course, are the three beautiful companions of our guest speaker today, Marian, Abigail, and Majesty. here with us today.
Thank you. Next table, can Eddie Galvez please do the honors of acknowledging our guests?
Yeah, I'd like to welcome our guest, John Rios, and past President Coratos, both of
Coratan.
sorry, Coratan.
VP
My
Coratan.
apologies. My
Welcome, Tita
apologies.
Cora. This table, can someone take the lead and acknowledge? PE Bing Matoto.
I'd like to introduce, good afternoon, folks. I'd like to introduce a professor, visiting professor, Professor Dr. Savas Tumis from the Rotary Club of Istanbul. There you go. And then we have here a journalist from the Manila Times, Mr. Vicente Cruz Jr.
Welcome.
And then my guests from Taiwan, President also of Yonganta Savings Bank, Regina Sega, and Susan Sega, also from Taiwan.
Thank you. Good job, PE Bing. Next table. Okay, go. Can we have Gov Tony or who's going to acknowledge our guests? Gov Tony o June Palafox? O Tess Asioche na lang? Come on, you can do it.
Hi, good afternoon. We have here Bianca Valerio.
Bianca Valerio.
Mimi. Hi, welcome. We also have
Bert Malapit and Baby Malapit,
Baby
of course.
Mandapit. Welcome to this
Meli
meeting.
Parunga has been acknowledged already.
Rita and Jenny Bosch.
Okay, thank you. These are our lovely aunts, by the way, who wield the real power. Next table, please. Let's do it in a more snappy fashion. Boy Arteche, can you please acknowledge everyone? Or do we have guests there?
Our guest, PP Randall Eastman from Shanghai.
Okay. Welcome, Randall. Next table, please. Okay, Bing.
Good afternoon. I'm PE Bing from Rotary Makati Business District. I would like to introduce my co-club members. They are from Makati
Greenbelt.
And then from, I didn't get your name. I'm sorry. I just met them right now. Virgie from Makati.
Virgie Monton.
Okay, you know them better. I'm so sorry. And Winnie Cheng from
Winnie Cheng is from Taiwan.
And so our members from Makati Business
Hello.
District. Our new member, Manolin Taylor from Cambodia. Okay. No need to stand up. Commissioner by Makati Business District and Tita Baby, RC Muntinlupa. Thank you.
Everyone acknowledged there already. Okay, last two tables. Hi, Amy.
Hi, my brother. Good afternoon. My name is Amy Cragen. I've been a member of Rotary Club of Makati Business District for the past 8 years, together with my kumare. Yes, 8, 9, or 10. But anyway, my table here, we're mixed. I'm with my husband, who is Brian Cragen, who is a former Rotary Club of Makati.
Welcome, Brian.
Club of
Welcome, Brian.
Yeah. And I'm with Kim Lukin, who is a new member of our club, Rotary Club of Makati Business District. And I'm with the president here of Rotary Club Makati Nilsson. And your name, ma'am? Jess, the president. And Makati Valero, Rotary Club of Makati Valero. So we're here enjoying our lunch and have a good day, everyone. And next table.
Welcome. Is that Congresswoman Kim Lokin? Yeah, your hair is a very distinct kumare. Nice seeing you also. Welcome, Congresswoman Kim. PP Imelda, last table.
Good afternoon. I'm past President Imelda Shetriales of RC Fort Bonifacio Global City. I would like to welcome our guests from this table, except, of course, the famous Ronaldo Arnaldo of Makati Business Circle. Here is PP from RC Pateros Mab Flores.
Welcome.
And our dear PP Manny Tamayo from RC Paranaque Palanyag. And also my dearest PP Sue Mendoza from RC Makati Bonifacio.
Thank you, PP Imelda. And last but certainly not the least, we have to run through all of these, all of our special guests via Zoom. Welcome. Welcome, Enrico Sunga. Fernando has no family name. Frida Fernandez, PP Helen Monzales, my classmate Josette Cortez, Lisa Bisnar, Marian Rengel, Mia Eroy, Tita Melly, I've already acknowledged. PDG Sue Santa Maria, hello. Tito Ruben Valerio is there, and Ruth Concebido. Okay, wow. This is the longest list, but we survived through it. So welcome, everyone. And we are so glad that you are here to spend the Tuesday with us. Now, we move on to the exchange of banners between RC Istanbul Galatasaray, led by Dr. Savas Tumis, and President Michael Escaler. Thank you so much for exerting effort in attending, Dr. Savas. It is such a pure delight to have you here. Welcome. One more banner exchange, President Michael. May we have your club name, please? Oh, Taipei Jade Spring, led by PP Queen. Welcome, welcome. That, ladies and gentlemen, is PP Queen, all the way from Taiwan. Thank you. Thank you so much. We now move on to the President's time. So, President Michael, would we have the lady go?
Okay, so we have a diamond pin for Felix, and for Grace, and pendant for Grace, and then their crystal. It's also my pleasure to call on Miss Bianca Valerio to receive the Major Donor Regalia for her parents. She is the daughter of Mimi and Philip Valerio.
Oh, yes, yes, please.
Hi. I know there's dapat walang speech, but I wanted to say thank you on behalf of my father, Ruben Valerio. I'm Bianca Valerio. He couldn't be here today because he's not as brave as everybody because of COVID. So my parents say hello, but just know that my father has been a member since 1974. He was the president in 2012. And I just wanted to say that there are only two events that my dad likes to go to. Anything that my mom is organizing or Rotary. So Rotary Club of Makati. He's never been more proud to be part of a club or to be part of a community. So he really made sure that I would come today and look postura. So Dad, this is for you. Thank you.
Thank you, Bianca. You know, when I was inducted 15 years ago as club president in 1998, Bianca sang a song. So, Bianca, thank you.
Bianca, sabi ni Gov Tony when he was inducted as president, you sang a song. You remember? Okay, that's your transaction between the two of you. You do the computing of the years. But later maybe we can request you to sing that song again. No, just kidding. All right. So we have acknowledged the two Paul Harris Fellows already. So we shall be skipping the ceremonial turnover first as PP Raiza is not yet here. Now we really move on to the president's time. So MIP Tess, you have any quick announcements? Please take the podium. Yes. Ayan, sige.
Good afternoon, fellow Rotarians. Okay. Okay. On behalf of my club and our project chair, the most dynamic and most inspiring chartered president, Mache Torres Ackerman. We shall be launching the Green Gala event next month. 2023 marks the 10th-year anniversary and Typhoon Yolanda. Same year and same night on November 8, 2013, when our club was chartered. Since then, our club has continued its advocacy to save the environment, and we are inviting our clubs to please join our cause. More details to follow. In line with this, we shall be having our Light It Forward caravan soon, headed by Director Ilac Diaz. We shall light up the country from the north to the south. On the other hand, our chartered president, Mache Ackerman, recently launched the project Online Visit at the CIW Correctional Institution for Women, which will benefit more than 3,000 women inmates in partnership with RCC, CIW. This is one of our club signature projects since we were chartered 10 years ago. With regards to our Hapag Movement project, in partnership with Globe Telecom, chaired by immediate past President Rachel Harrison, we are inviting more clubs to partner with us. And we would like to thank our incoming member, Chef Jessie for joining this cause with other notable chefs nationwide. During last year's presidential conference, our clubs, AKS, our Club Society member, chartered president spouse, past president David Ackerman, donated directed gifts to TRF, the Rotary Foundation, amounting to $40,000, which they directed to Palawan's educational projects, the computerization and solar light installation of schools will be launched next month. And we are inviting all the Palawan clubs to partner with us. Thank you so much to the very generous couple. Let us hear from Chartered President Mache Ackerman, who will talk more about the project. Thank you and have a pleasant good afternoon.
Thank you so much to my MIP Tess Castro. So that directed gifts that we are offering to all the Palawan clubs was launched during the DISCON last year of 2021, when me and my spouse, PP David Ackerman, offered these directed gifts for education to all Palawan clubs. So please, all Palawan clubs who are attending the meeting online, please join us with this partnership, and please coordinate with our president, MIP Tess. And we are inviting other Rotary clubs as well in the district to please partner with us. This is a huge educational and environmental project that we are doing in Palawan in partnership with PDG Gov Edna Suter as well, when she did her directed gifts with the bamboos in Palawan. So thank you so much. And okay, so we have our MC now here, Andrew. So now he's here with us.
Thank you, CP Mache. Sorry, I'm late, but on with the program. So now we have President's Time with President Michael Escaler.
Good afternoon, everyone, Rotary Club members. Welcome to our first meeting in February, the Love Month. Before anything else, we would like to have a moment of silence for the victims of the earthquake in Turkey and Syria. Can we have a moment of silence, please? Thank you. Allow me to thank our guest speaker today, Dr. Christian Mancao, for taking time to be with us today to appraise us of an important treatment for the many illnesses that ail all of us, stem cell therapy. That's why you see a lot of the women here are present today to see how they can keep young forever. Especially Mita Sullivan, who never appears, but we are so happy to have you here. Thank you also to our daughter club, RC Makati Business District, in particular Ms. Tess Castro and CP Mache Ackerman for agreeing to co-host this meeting today. Allow me to share with you our upcoming activities in this Love Month. 10th of February, 10:30 a.m., we have a complimentary feeding program in Bay Laguna for 90 children in 3 barangays. Thank you, PP Freddy Borromeo, who is a constant giver to this program. Thank you, PP, for overseeing this program. On the 13th of February, we have Valentine's Day for the Makati Rotary Club at 6 p.m. at the Manila Golf Club. The Valentine's party with the theme is Wine is Red and Violets are Blue. I am happy that over 100 members of the club and aunts have confirmed their attendance in this event. I would like to thank PP Carlo and Katrofina for organizing this whole event. On February 19, February 22, the inside trip with ARK for the feedback program in Inabanga, Bohol, where we sponsored the vegetable exchange program in 6 communities. I hope you can be there to take the trip to Bohol. This ARK project was brought to us by none other than Director Philip Sullivan, who got this program from New York. Thank you, Philip. On the February 24th, Friday, we launch on MOA assigning on the Clinic in Cloud project in Calibo, Aklan. I would like to thank our IPP president and very Louis Aseoche and Director Andrew Prieto for more than 1,000 patients who will benefit from the service. I hope that other members can accompany IPP Louis on this trip. Louis, where's IPP Louis? Say something. Oh, say something.
Thank you, my president, to the rescue. He has some pharyngeal problems now. So, yes, Director Andrew, will you be joining me in Calibo for the Clinic in the Cloud? This is our project. Anyway, this will be on the 24th of February until the 25th. So it's an overnight affair. And also for Eddie Galvez might be joining us in the insider trip with ARC at the Inabanga, Bohol. Philip will be covering Negros Oriental. We might be covering Bohol, and that will be immediately after the birthday lunch of my wife, my lovely aunt Tessa Sioche. Thank you very much.
Thank you, PP Louis. Okay, so let's go to the next part of the program, which is the introduction of the guest speaker. We have PP Fred Parungao.
Fellow members and guests, pleasant good afternoon. I know that you are very eager to listen to our guest speaker, but let me tell you something about him first. He is an accomplished medical practitioner and a chronic muscle pain specialist. He is the innovator of a safe, natural, and amazingly effective method that instantly relieves the more common chronic pain syndromes. He is an alumnus of the University of Santo Tomas. He was chief of clinics in Riyadh, Saudi Arabia, for 8 years. Subsequently, he joined the operation of the National Security Council for Desert Storm. He saw action in the Saudi-Iraq border. That makes him an authentic Desert Storm veteran. But he did not tell me which side he was on. I hope he was on the right side. After returning to the Philippines, he trained in Arizona and Nevada in the fields of prolotherapy and ozone therapy. Presently, he is a stromal vascular fraction therapy practitioner, quite a tongue twister for a non-medical person like me. This therapy is widely used for the renovation and improvement of a great number of disease conditions, including osteoarthritis and fourth-stage cancer. Fellow members, guests, ladies and gentlemen, it is my distinct honor and privilege to introduce our guest speaker, Dr. Christian Emmanuel V. Mancao.
Thank you very much, Fred. President Michael Escaler, the other presidents of other Rotary groups, past presidents, members, Rotarians, and those who came here for the interest of knowing what stem cell is all about. Normally, I would begin my talk with pain management because that has been my passion. Removing pain instantly with nothing. Because for your age group, your biggest problem is the side effect of medicines. Every time you have a pain and you go to the hospital for treatment, you will have a big problem. So I will do the presentation without the prepared presentation I have. But if you had severe pain, maybe in the knee, and then you go to the emergency room of the hospital, you'll be first seen by a physician, a general practitioner, family medicine practitioner, who will scratch his head. He will scratch his head because he has to imagine who sa mga barkada niya of all the group, because we are now in group practice. Remember, the business model is group practice. So he would say, most probably, it will be ortho. True? Orthopedics. The ortho guy will do all the tests and say, I can't see anything. I will refer to rheumatology. Then the rheumatologist will not see anything, doing all the tests, maybe the same tests that was done earlier, and then refer to the neurologist or the anesthesiologist. But they will eventually refer you to rehabilitation medicine, physiatrist. And the physiatrist, of course, will ask one question. How old is the patient? You have to have a cardiac clearance if you are more than 40 years old. So that means you'll be seen by a cardiologist. And when your laboratory tests come in and there's a little increase in your sugar, you will be seen by 3 other doctors. True or false? 3 other doctors, one for possible treatment of your diabetes, one ophtha, and of course, one for your kidney. Now you have already been seen by more than half of the hospital. In my clinic, I remove pain instantly with nothing, especially the more common complaints of the ladies: neck pain, shoulder pain, back pain. Of course, I do not do the most severe pain of all, which is actually called the empty pocket syndrome. Sometimes it's called bursitis. And the other one is falling in love. I cannot do anything about that pain. That pain is very, very severe. Falling in love. So don't fall in love. Why? Love always goes with extreme pain and suffering. Now, aside from that, from muscle contraction, headaches, which is very easy to do, migraine can easily be stopped in 1 second. So let's have a consensus among you pain sufferers. How many suffer from pain now? Raise your hands. Wow. This is a target-rich environment. My next question. Do you know of somebody at home or close family who is in pain? Raise your hands. Pareho pa rin, ano? Maybe parents, grandparents, whatever. Apparently, so many people are in pain. Now, if you're in pain, what is the best medicine for pain? Salompas, very good business. You know why? Methyl salicylate will shut down your kidney. And when you go for dialysis, what does the doctor say? Till death do us part. So what is the safest medicine for pain? What do you think? If you have a headache, that's already a big caliber gun. Cortal, problema sa tiyan. Dulcet, Alaxan. Well, you still remember that 500 milligrams of paracetamol, where John Lloyd always says like this. What does he say? When he does a finger like this, what did he say? Ingat, because there is truth in advertisement. The #1 cause of liver failure in America is paracetamol. Don't worry, it kills only 500 Americans a year. Only 500. But it will admit 60,000 through the emergency room. The suicide dose is only 12.5 grams. I should know. I have treated patients who attempted suicide, isang banig ng paracetamol. So, I stopped thinking about being a drug pusher and started to remove pain instantly. Just touching people for 1 second, 15 seconds at most. Now, lately, for low back pain sufferers, before you go for surgery, just undergo dry needling and voila, in just 1 minute, you are pain-free. You don't have to undergo all those crazy tests. But if aging has already made its mark on you, then you have to undergo what we call regenerative or restorative medicine, which is available now, which I have been teaching for the past 10 years. 10 years ago, I was the one who taught fat-based, yung liposuction. Because the most dense area of stem cell deposition is in the hypogastric area. Huwag niyong itapon yon. Especially the ladies. don't undergo liposuction because most of your stem cells are in the hypogastric area. So there are two major approaches for stem cell. Especially, even the boys, when they have this nice abdomen, that's where the stem cells are. Bilbil. So don't do tummy tuck. Tummy tuck will totally remove all your deposit of stem cells. Now, life begins, 40 years old. Still remember, ladies? Life begins, again, what's the saying at 40? Life begins at 40? No, life begins to deteriorate at 40. At 40, diabetes, hypertension, cancer, osteoarthritis, cataracts, whitening of the hair. So many things happen to you. This will start accelerated aging. For females, estrogen and progesterone goes down, and you enter a period called menopause. Did I say it right? Did I say it right? Menopause. But men at 40, oh my God, the testosterone is less than 40%. That's why they start to look for Daisy. Still remember Daisy? Anyway, 40 is the age group for midlife crisis. That's a nice question. They look for Daisy 6, Daisy 7, Daisy 8. But don't do that in Mindanao. Don't do that. Because I got the shock of my life when I was doing stem cells for cancer in Cagayan de Oro. And they said, "Doctor, that's very old." I said, "What? Daisy is old?" No, I said, "Here, we do vitamin C." Whoa, what's vitamin C? 11, 12, 13, 14. So at that age, 40, it causes accelerated aging. One of the bigger problems of accelerated aging, especially for females who have been carrying heavy bags always, is shoulder pain, so many pains, and cancer sets in at 40. So a lot of ladies, they complain of breast cancer or reproductive cancers. And of course, others complain of other forms of cancers. Now, my passion for stem cells started in the year 2012, when I started to doing a population which was 80 and above, 80 and above. And strangely enough, when we're doing patients like this, they would improve dramatically, dramatically. So I started to shift from ordinary degenerative problems to fourth stage cancer, which is my passion actually. Because fourth stage cancer, most of us doctors in practice cannot do anything anymore. You can go to Banahaw or wherever else, or you can see spiritistas and whatever. But fourth stage cancer is difficult to treat. With stem cell, there's so much hope. That is why my passion for doing stem cells has been increased dramatically. But females, after 40, they become they have problems of dementia, which the husbands like, because they keep on forgetting things. They enter the room to get something, they cannot remember it. And the husband likes that. The more she forgets, the better. Okay? Not only that, they begin to have knee pains. Aside from the neck and shoulder pains, they have osteoarthritis. And the problem now is surgery, because a lot of doctors would say it's better to undergo surgery. But nowadays, for the past so many years, 30 years, surgery is out of the question for osteoarthritis. You just give platelet-rich plasma injections, and in 1 month, 3 injections in 1 month, 2 weeks apart. And the cartilage plate grows back, the synovial fluid goes back, and your functionality is recovered. You don't have to undergo surgery. Now, the patients I do in the clinic are not the ordinary ones with stage 1, stage 2 osteoarthritis. These are the osteoarthritis of the hip that is totally welded already. But when you do PRP, strangely enough, they start to move around. So the earlier you try to think of doing a stem cell procedure or platelet-rich plasma procedure, the better for you. What we do is just to improve the quality of life. Just to improve the quality of life. When you see a 4th stage cancer, you get shocked because they're so depressed. Not only the cancer, it's the depression that is swallowing them. But when you treat them, then you see the smile and the glow in their face, and they enjoy what's left of their lives. Let me share with you a case in Cagayan de Oro, which had cervical cancer and was bleeding like hell. So she finally decided to die at home. But between hospital and home, she passed through me, and I had to do a stem cell procedure, which I hesitated to do. But I still did it because opening the legs alone, 200 cc of fresh blood will go out. And she lived for 7 years. 7 years. Now, how can you explain that? Medical science cannot explain it because the doctor already sent her home to die. But here in Manila, I have also very good cases. And this is where the magic of stem cell comes in. So some of you have already been stem celled. There are many forms of stem cells. Stem cell cannot be placed in a capsule. Some of you are taking stem cell capsules. You cannot put live stem cells in capsules. Remember that. And you cannot use deer stem cells. Because if deer stem cells will live in your body, what will happen? Deer is 70 chromosomes. You have 46 chromosomes. So what will happen to you? Then you'll have an itch here. And later on, you have a horn and a tail. So what are the other stem cells that you know? Many years ago, 64 years ago, they started to do bone marrow stem cell. 64 years ago, they did bone marrow. But bone marrow yield in stem cell is less than 1,000 stem cell per cc, while fat is 5 million per cc. So what's the difference between 1,000 and 5 million? Definitely, I'd rather do fat stem cell rather than do bone marrow. Now, both bone marrow and fat stem cell, especially if you extract the fat to separate the stem cell from the fat, that will entail a major operating room complex. And that's scary. You have to have an anesthesiologist, a surgeon, and nurses inside the facility. And if it were liposuction, can you imagine 1 month of having a abdominal support? And the risk of fat embolism, air embolism, sepsis, hematoma, and so many others, you can even die in the operating table. But nowadays, it's so easy to have stem cells because they found out that the progenitor stem cells from the bone can easily be harvested in your blood. We harvest it from the blood. We extract half a unit of blood, which is about 240 cc, harvest the progenitor stem cells with the platelets. By the way, the secret for healing is platelets. The platelets are the ones that secrete growth factors, chemokines, cytokines, exosomes, which wake up sleeping stem cells. Remember, at 40 years old, your stem cells, which at 15 was 95 million active stem cells, at 40, it's less than 20 million. That is why when you were 15 years old, when you had a small scratch, in 3 days, it's gone. But now, if you have a scratch, in 2 weeks, 3 weeks, it's still a scratch. If you had a fracture when you were young, easy to heal. But when you are 50 and above with a fracture, my God, it will take a long time to heal. So, even fat-based stem cell now, I do not harvest the fat anymore to separate it, because when you process it and separate, the problem is you're using toxic chemicals on the stem cell. And when you wash it with a solution that will kill it further, the final yield of stem cell will be very low. The best approach now is to leave the stem cells there in its natural environment, wake it up with activated stem cells from the blood and activated PRP. This is a walk-in, walk-out procedure. You just stay in the clinic for about 4 or 5 hours, and it's finished. Now, all you have to do is just tell me what other part of the body has pain. A lot of people, they always complain, females always want their face to be improved, because as you hit 40 and above, the lines go out, crow's feet, deeper nasolabial folds, marionette lines, and all that stuff. Now, if you inject stem cell there, in just 2 weeks, you can see the effect already. And it will last. It will last for 2 years, 5 years. Depends on the diet you have. If your diet is more acidic, then faster you go back to your original state. Now, what I do, especially among females, is when I do the face, I do the hands. Because you notice, as you grow more than 50, there's so many canals and the veins are very prominent. And of course, you don't want to use your bikini because you have so many stretch marks. So that's what I do, stretch marks, and I do the varicose veins. So it's something total for females. For males, I just wake up the dead, that's all. That's my job. I just wake up the dead. So maybe it's better if we have an open forum for specific questions, because I know that some of the people here have already undergone stem cells and they would like to know more about what happened to them. So anybody interested to start the ball rolling? That depends on how many problems you have. Because I'm the one who does stem cells for COVID. By the way, don't do COVID early because the hospital management would not like it. The longer you stay, it's a profit model. And we're doing post-COVID for boosters. Those who have been boosted, who have frozen shoulders and whose skin looks like snake, that's what we do. Now, for the alpha variant of COVID, the problem was memory. And when you do stem cell, after 1 week, the memory comes back. But the Omicron variety is more on myocarditis and cardiomyopathy. And that can be addressed by stem cell. So, yes, sir.
Yeah. I'm hesitant to share this. My wife, after she got a booster, fifth vaccine, her health failed. kidney. Now she has dialysis twice a week, and she would hardly walk. And March last year, she was walking 17,000 steps a day in Dubai. 1 week after the booster, her health collapsed. And I had a classmate in Florida, after his booster, paralyzed neck down. But not many doctors would admit because it's the booster. And question, you can still restore? Number two,
yes, yes, sir.
Is it the booster? You don't have to answer me.
It would be a standard stem cell, sir. We do usually a standard stem cell for cases like that. And if the improvement is not that acceptable, usually after a month or so, we can do another procedure.
Stem cell to restore.
Yeah, of course. Stem cell boosts your immune system. That is what stem cells are all about. It boosts your immune system and gives back your energy.
Yeah. Okay, thank you.
That's why it's the mainstay in regenerative medicine or restorative medicine.
Yeah. I'm glad we spoke a while ago because I was advised about my bum knee. Advice either injection or surgery.
Well, most of the injections, by the way, a lot of sports injuries, Kobe Bryant, Tiger Woods, Rafael Nadal, every time they have an injury, they use stem cell, mini stem cells, platelet-rich plasma, PRP. And within 3 injections, they're okay already. And that's what we do for the knee. We've been doing that for a long, long time. Even in prolotherapy, I did my prolo in Phoenix, Arizona, and that's what we were doing. So much hope, sir. You don't have to suffer the pain and discomfort of the knee. Just have PRP. Finish.
Doc, I have a question.
Yes.
We're here behind you.
Oh, yes, ma'am.
Yes, Doc. So we know that stem cell has been something that's not as new because a lot of doctors or clinics market this worldwide. There is this kind of stem cell that has been also marketed, and I'm sure you know about the sheep or rabbit or the stem cell from embryos. Can you please comment on those?
Embryonic stem cells are not allowed in America because President Bush, many times, they vetoed the funding of it. That's why America is 12 years behind in stem cell technology. They're always behind anyway. And you would not want sheep stem cell. If we're talking about stem cell, what you are talking might be stem cell products.
There's one that's from Germany.
Baba black sheep. Germany is Baba black sheep. It's a special kind of sheep that has been monitored for so many years to have no problems. And this is what they're using. They will abort, if you're diabetic, get the pancreas, pulverize it, process it, and inject it on a series of injections, not only once. But a lot of those who went to Germany came back, they died. And I also did them. Actually, I do stem cell failures. That is why I scratch my head when the patient comes in front of me, because I know that my colleague, doctor, has discussed the problem with the patient, and then more problems happen.
All right. Thank you, doctor.
Doctor,
Mike.
I was interested to hear that stem cell also helps your memory.
Definitely.
Yeah, but I forgot my question. So can
Andrew maybe can give the answer.
I forgot. So Andrew will ask a question.
Thank you very much, Doctor, for enlightening us about stem cell therapy. I guess a lot of being a doctor myself, a lot of patients ask about stem cell. Do you feel that this is a mainstream treatment or an alternative treatment for And for which indications? Which indications do you think it's mainstream where it's proven to help, and which indications are still investigational in your view?
If you hit the topic of stem cell in the computer, you will say millions and millions of sites about it. And you would say it's experimental. The bottom line is simple. What is the business model of the hospital and the doctor community? Business model. I don't want to hear the statement that doctors are slaves of the pharmaceutical mafia. I don't want to hear that. That's bad for my ear. But do you think we can escape from that? My patients want to take fish oil, but no doctor in his right mind will prescribe fish oil. Why? There are no free trips abroad. True? By the way, genuine fish oil can easily lower cholesterol and triglycerides. It makes your circulation very, very nice because the platelets are not sticky. So it prevents heart attacks and strokes. More important for females, it prevents dementia because the DHA is very high in fish oil. I'm talking about genuine fish oil, not the Kirkland buy one, take one big can from US. It has to be either from New Zealand or Australia, which are all pharmaceutical grade. More important is I use it for cancer management. Fish oil. But for those suffering from osteoarthritis, rheumatoid arthritis, oh, that's a very good lubricant. And you can even take the whole bottle and wake up the following day. But if you try ecoxib, even celecoxib, which we do not teach our patients when they take, that if they take the medicine, they cannot lie down because it will perforate their esophagus, that's a big problem. Very big problem. So we have to be conscious about our Hippocratic oath. We have to be more in favor of the patient rather than the business. Any other question? Who has undergone stem cell already? Yes. You have undergone stem cell? Ah.
Because, for example, Taiwan is famous also in medical industry, and we have high technology and professionalism in stem cell as well. But unfortunately, because of the industry problem around the world is the same. Because 2018, finally, our DOH announced it's legal. You can apply to hospital for stem cell, the therapy, but only when already claimed the 3 typical type of cancer therapy you already done and announced useless. That's the moment you can apply. So my question is how is the practice in Philippines, and how's the purity and the viability of the stem cell you're using? And the third question is, are you already using like human stem cell? Because what we're using, like the MSC we're using is 2 types. One is your own body. The other is from other people's stem cell to do the breeding. Yeah.
The best stem cell is autologous from your own body. The problem is at 40 years old, your stem cells are sleeping already. Remember, females, your estrogen, progesterone goes down at 40, and your stem cell, 95 million, starts to sleep. And that is a big problem. We have to wake them up. And it's easy to wake them up. Nowadays, it's so easy to wake them up. And a procedure that is very safe, ultra safe, and will not entail hospital stay. It's walk in, walk out in the clinic. You have to understand the methodology of waking up the stem cells. But you can easily harvest hematopoietic stem cells from the blood, concentrate it, activate it, and give it to the patient. My procedure is actually I do 2 stem cell procedures in one. I harvest the one from the bone marrow, the one that is floating in the blood. I concentrate it, activate it, and then I do another stem cell. Wake up the sleeping stem cell in your hypogastric area. So every time I do a stem cell, it is 2 stem cell procedures in one. And it's very simple. Go to the clinic, we extract your blood, we process it for 3.5 hours. You come back after 3.5 hours, after you go to a movie or whatever, we will give you anesthesia and inject it. Inject it here. Wake up the sleeping stem cells. And I also give a bolus dose IV for the heart, the lungs, the brain, kidneys. Very simple nowadays. Don't make it very complicated. Making it complicated gives too much cost. I would say more than 80%. You know why? They are in their natural environment. We did not harvest the stem cells and put harmful chemicals. I'll give you a story of adipose-based. I should know. I was the one who taught adipose-based here in the Philippines in 2012. You give anesthesia. We call it, 1 ampule of adrenaline plus 50 cc of lidocaine are very acidic solutions, very acidic. If our blood pH is 7.35, 7.45, if our blood pH becomes 7, the cells will undergo apoptosis or natural cell death. If it is 6.8, it will undergo necrosis. It will just liquefy. But the fluids that they're using, especially for the embryonics, the one from the placental tissue, the pH is 4 to 7. So the stem cells there are dead. So as far as purity is concerned, it's there. They're in their natural environment. We just wake them up from something that has been processed from your own blood and put there to wake them up. So it's a walk-in, walk-out procedure and no harmful chemicals. The problem actually is when you're using allogeneic, meaning to say from other humans, because it will cause graft versus host disease, which is very, very terrible. And it can cause your death. So simplify. You need something simple. You don't have to make it very sophisticated and very expensive. It will range from $500,000 to about 2 million or 3 million pesos. It will range from $500,000 to, yeah, more or less, and higher. But remember, a lot of people, they want more than just the stem cell. They want beautification. They want many other things. Anyway, while we are in the topic, in 2012, I had an 84-year-old patient who requested G-spot lifting. And I was shocked. My goodness, 84-year-old, what? Requesting for a G-spot lift? I said, Lola, kailangan ba yun? You know what she said? My boyfriend outside waiting for me. DI pala yun. So you see, you have to put stem cell in the fat to lower the G-spot. Because the Filipino anatomy, the G-spot is behind the pubic bone. It cannot, you know, the organs of Filipinos and Chinese are relatively small, not very, very big. That is why you have to lift it. And these are interesting aspects of doing stem cells. Yes?
Doctor, congratulations and thank you for all this wonderful information about it. Could you also share what are the possible side effects, negative side effects of enhanced
stem
and
cell?
do you also manage corneal degeneration?
Corneal?
Degeneration.
Ah, I have to tell you one story which I did not want to tell anyway. I had a patient for pain management who was legally blind on one eye. Legally blind by 3 prominent ophthalmologists here in Manila. And all of a sudden, she said, "Doctor, you're doing stem cells?" I said, "Yeah." Because she heard me talk about stem cell to a patient when she was being treated. So I said, "Yeah." I said, "Doctor, can you do stem cell on me?" 47-year-old female. I said, "Why?" Because my doctor said, if I don't have the injection costing 100,000 per month for life, the problem I have in my right eye will transfer to my other eye and I'll become blind. So I said, "Yeah, okay, let's do it. But I'm not going to promise you anything." So I did a retrobulbar injection. And you know what happened? When I was supposed to do the retrobulbar injection, the anesthesiologist stopped me. Said, "Dr. Mancao, that is a procedure for the ophtha." I said, "Oh, the ophtha is supposed to be the one to do that." So I said, "I have a license." I told him, "I have a license. My license is 43502. And he said, "No, only ophtha will do that." But the ophtha is not a stem cell practitioner. So I asked him, "Where did you train?" He said, "UP. Oh, UP. So I mentioned the names of the professors in anesthesia who are my patients. And then all of a sudden he said, "Doktor, ikaw pala yung payat na palaging tinatawag ni chairman?" "Yeah, ako yun." "Now you want to ask for my license? Can I ask for your license? You're an anesthesiologist. Do you have a license as an anesthesiologist?" There was no answer. True or false? How can you have a license as an anesthesiologist?
What's the answer to the corneal?
So the nice thing was he kept quiet. 6 months later, the patient was reading a newspaper in front of me. I told the patient, "Now, please go back to your doctors for a re-evaluation." You know what she said? "That's the last thing I'll do. They could not even do anything about my eye. Then I'll have to go back there for an evaluation."
So you do manage corneal degeneration.
It's better to put stem cells closest to the area of problems because your body cannot repair it anymore. You understand? All of us have the natural capacity to heal. But as we grow older, that capacity goes down. So you have to assist it. And one of the ways to assist it is to do live stem cell procedures, not dead stem cells.
Thank you.
Yes. Yes.
Hi, it was really interesting when you said that, the pharmaceutical industry, it is a money-making business. So there are a lot of doctors who want to keep you on medication because it's good for business. But like I think that a real good doctor their goal is to not see you in their office anymore, at least for a long time, correct? So my question is, let's say somebody had stem cell treatment with you. Is there like what do you call it? Like medication that's for maintenance to make sure it's working, or it's like, as you said, like get in and go and that's done?
For diabetics, I always request for a lifestyle change. I always request for a lifestyle change. I will not do the procedure if the patient will not commit to a lifestyle change. Okay, for diabetics. Because it's useless to do this stem cell and they'll still do the same thing over and over again. So I have patients who are smokers with cancer. And I tell them, don't go back to smoking. Just because you feel good and you can breathe better and you can walk how many kilometers? So the problem actually is simple. A lot of us have so many health concerns, especially after 40, And you can easily reverse that to become more normal, can reverse it. So going back to your question, what particular case do you want to ask?
Sir, it's not so much that there's a certain case I want to address. I think it's more of the post, I don't know, procedure. Like are you going to prescribe like all these medicines to make sure it, I don't know, it works better or it lasts longer? Parang almost like it defeats the purpose.
Okay.
Yeah.
The first thing you do is lifestyle change. Our body is very acidic because nearly everything you eat are acids. You drink Coke, the pH of Coke is 2.3. It's good for removing rust. It's good for cleaning the toilets. Yeah. Our body, pH 7.35, 7.45, very narrow. And that is a big problem if you do that. So if you eat more greens, more vegetables, vegetables are alkaline. So, but choose the ones with no pesticide, fungicide, whatever, herbicide and suicide there. Okay? Use the ones that we do not spray. Now, what are the green vegetables that we don't spray? No, there's no organic tester. Organic is just a label. You don't know if it's organic or not. You have to look at you look for the worm and the spider. If you see the worm and the spider, that is organic. But if it's very nice looking, GMO yun. So, yes, sir, you have a, I'll just finish. Vitamin D3, high doses of vitamin D3, 3,000 international units. With high vitamin C, glutathione, if you can get glutathione, because our liver, as we grow old, is not producing enough glutathione. Alpha lipoic acid to recycle your glutathione. That will help you a lot. Okay? Yes, sir.
Sir, can we say one of the worst poisons in the world is sugar?
Definitely, 100%.
But artificial, also natural sugar.
It will be basically the same.
Thank you.
Basically the same, because we are not, the problem with our parents is they taught us to become sweet tooth. Always gave us all kinds of chocolates, whether they're natural or unnatural.
Yes.
And this is the one that is giving us problems, actually.
And what I also studied in the last time, I'm not a medical doctor, studied is even the fruits has a lot, they have a lot of sugar. It's very also not good for the health. And I heard the #1 fruit in the world is the blueberry. The second is strawberry. The third one, maybe kiwi, maybe. But all other fruits, rice, noodles, everything has sugar.
That is why in diabetes, we always tell the patient, what is the best rice? Is it white rice, pink rice, brown rice, red rice, or black rice? It's always memorize. And that's a very good point, sir. Remember, the sugar in fruits, our body has the enzymes to process that. It's God-given by nature. But the unnatural, synthetic sweeteners by Monsanto, that is the one giving us problems. And it's good for the doctor business. Very good. Thank you.
Dr. Mancao. Doctor, wait. Go ahead. Go ahead.
Yes. Yes, sir.
Doctor,
Yes, sir.
I understand that arthritis, my doctor tells me, is an autoimmune disease. That's my own body is working against it. Is that the way it is? So
There are more than 100 types of arthritis, sir. Which arthritis are you talking about?
something that deforms my fingers.
Uh-huh.
Okay, so how does stem cell help in this situation?
It repairs the problem. It repairs the problem.
In
The
what
most
sense?
common, the largest joint of your body is the knees. Okay? It's major weight bearing. And that is the one that undergoes wear and tear all these years. And then when you have degenerative joint disease, the only option before was just to do knee surgery. But undergoing surgery is a big problem for your age. You know why? When you wake up, you might not know who you are because it's general anesthesia. With general anesthesia, even the females, when they undergo cesarean section, when their minds are blank already and they have a good excuse. But, sir, most of the kinds of arthritis can easily be treated not by stem cell, these big stem cell, but by mini stem cell procedures, the platelet-rich plasma. And you don't have to suffer it.
But that means you inject it on the
Inject it there.
I see.
What joint has the problem? Just inject it. You have to assist or facilitate the natural healing capacity of your body to heal. That's all.
So you have to withdraw blood.
Yeah, normally we withdraw about 60 cc of blood. We process it for 4 hours and inject it there.
I see.
But normally you would want, at your age, you would want to have both knees done as prevention because usually at that age, it will begin to give you problems. Aside from the fingers, of course.
Thank you.
Dr. Mancao, we have a question from the president.
Yes, Mr. President.
Regarding one of our members.
Hi, Doctor, thank you for your speech. We have a guy there called Winston Uy, and he has eye problems. Can stem cell help restore eye normalcy?
He can try it. He can try it. We can give it retrobulbar and we give IV push.
Which one?
Intravenous push.
Intravenous. Okay.
By the way, for the information of everybody, stem cells have a very strange capacity. It's called homing. Homing. It knows exactly what part of your body has the problem. And they will go there and fix it. That is their, that's their job. That's why we just give it IV. To whom it may concern, the stem cells know where to go. It's homing. You can research on it. It's a very nice characteristic, homing.
Okay,
yes, sir.
Yeah, we have one more question from the lady on the table there, the last table. Can we bring her a mic?
Good afternoon, Doc. Hi, Doc. Good afternoon.
Yes, ma'am.
I just want to clarify something. I have two questions, actually. One is, can anybody qualified to have stem cell using platelet? That's my number one question.
If you are harvesting platelet in a special manner, not for PRP, because some practitioners who are not properly trained, the PRP they do is just 10 minutes spin. After 10 minutes, they will spin it, extract the platelets, inject it to you. The platelets are still in the same morphologic form. But if you process it, you tickle it, activate it, it is not a plate. You know, platelets look like plates. They will look like so many feet and arms. And they're producing so many growth factors, chemokines, cytokines, and they're very effective for stem cell activity.
I understand. Is there, how do you call this? Clearance, medical clearance before you undergo the platelet or the stem cell treatment using platelet because platelet can cause major blood clot. And if the patient is suffering what we call the opposite of anemia, it's called polycythemia, right? Polycythemia, if the patient is suffering polycythemia and if it's also suffering cholesterol, high cholesterol, platelet is very high, and suffering polycythemia, combining both, that can cause also a major problem like stroke. So injecting platelet, is that safe to those patients or to those person who is suffering that kind of medical condition?
What you are injecting is primarily growth factors, chemokines, cytokines, signaling molecules to wake up stem cells. Now, my cases for thrombocytosis, meaning to say too much platelets, are from America. And she's coming back on March. And she's okay.
Thank you.
So there is no effect even if the person...
No problem. As a matter of fact, we do not request for a medical clearance.
Okay.
Why? Because the procedure is so simple and very, very safe that we just request for
So you do not need
we
to
just
require
request for a
medical-
baseline biochemistry, baseline for everything, so you can compare after 6 months if there's improvement or not.
Oh, okay. Because I had LASIK in my right eye, and I thought I recommend LASIK. I'm okay, and I recommend LASIK to my cousin, and I thought everyone can be.
No.
And not everyone can have LASIK.
Not everyone
anyway.
can have that.
I
But this
Thank you.
technique of stem cell we're doing now, remember my next patient this Friday, I think, is 98 years old. Yeah, 98 years old, and she's champion in card games. At 98 years old. Oh, she will be 99 now when she'll be coming back. Mhm.
Okay.
Thank you, doctor. Thank you.
I think we only have time for one more question. Okay, PP Louis, real quick. We have one more after you.
Actually, it's past President Bimbo Mills who requested, or rather pleaded for me to ask this. Earlier, doctor, you said that you have the ability or you can make the dead rise from the grave. And past President Bimbo Mills is asking for details on how you can do that.
If you look at the text on what we do in stem cell therapy causes angiogenesis, the creation of new blood vessels. Because as you grow older, your blood vessels shrink and shrink. Everything shrinks when you grow old. Your brain becomes small. Even the balls become small. Everything becomes small. You understand? But if you do stem cell therapy, then you notice that that's why it's called restorative or regenerative medicine. And in Turkey, they're doing good stem cell procedures there.
So where do you apply it now? According Bimbo, where do you apply it?
The blood vessels primarily affected, aside from the main nerve of the is intracavernous injections. Intracavernous, both sides, both cavernous bodies. That's where we inject it.
Thank you for that information. Okay, one last question from my Tito Bert and Lapit. One last question. So many questions.
Thank you.
Yes,
Thank
sir.
you very much. Thank you very much, Dr. Mancao, for the education. Just one quick question. Are there any known medical downsides related to stem cell therapy? Any downsides that you have encountered?
That's a very good question, sir. If you do bone marrow, that's painful, sir. The caliber of the needle is so big, and you have to hit the periosteum. The periosteum, very painful. And you can develop fibromyalgia. Fibromyalgia is pain everywhere syndrome. So, you can have fibromyalgia. Bone marrow. Now, if it is fat, oh my God, nightmare. Because you can have fat embolism, air embolism. You can have hematomas, big hematoma, and infection. And you can die on the table, especially from the anesthesia, because you have to anesthetize the patient. But
So what do you do?
the anesthesia we use is just local anesthesia, xylocaine spray.
One last question. My mom, she's allergic to everything. So it's really hard. Like we always have to watch everywhere we eat, what we touch. Can stem cell reverse allergies, like severe allergies?
I believe that one of the indications is to improve the immune system of your body, and in the immune system boosting, part of that is hypersensitivity to nearly everything.
So
It can. But I would strongly suggest you research further on it, because it's so easy to search for it in the internet. But definitely it will boost the immune system.
Okay, I think that's all the time we have for questions. We just want to thank Dr. Mancao. And also, how do they get in touch with you, or how do they find your clinic?
Those who might want to know how to contact me, if you want, they can give you my address, clinic address, if you are interested. And if you have further questions, you can call my number.
Thank you very much. So thank you for that wonderful talk, Dr. Mancao. And now we have the time for the presidents to respond. We'll start with President Michael.
Thank you, Dr. Mancao, for a very, very interesting talk. I don't think we've ever had this kind of attendance before. And obviously, everyone wants to stay young and healthy. And you gave us a lot of hints today on how to do that. So my wish is that the next time we gather together, we will all look a little younger and healthier. Thank you, doctor, and have a nice day. We just want to award you, doctor, certificate of appreciation.
President Michael. President Michael. Shall we adjourn the meeting? You have the power to adjourn the meeting.
On behalf of the Rotary Club of Makati, thank you all for coming. I hereby adjourn this meeting.
On behalf of Rotary Club, Makati District, I adjourn this joint meeting.